and Dr. Carrie Weinecke. Dr. Weinecke is our chair of OBGYN, Obstetrics and Gynecology here at the University of Kansas Health System. We wanted her to come on because we've had a lot of questions that have come to us around things related to pregnancy, COVID, transmission to the child, how moms do it with pregnancy, and so we thought we'd talk with her for a moment. Dr. Hawkinson, any updates on our numbers? How are we doing out there?
Yeah, our numbers are still the same. We're about 33, 35-ish. Still same number of people on the vents. We still have continued rule-outs of around 15 to 20 every day, sometimes a little bit more. But as far as the number of critically ill, our numbers are just about the same as yesterday.
Yeah, which is, I think, good news.
That's good news.
Are we flattening the curve, Dana?
Well, I'd like to bring that up. You know, there's a lot of talk now, and yesterday we saw some articles about projections. You know, projections are projections, and they are based on data, and they are based on hopefully the most up-to-date data, but it's based on the variables that we put in. And we understand that the projections from today can change from the projections what they were a week ago, from where they will be in a week. And so it's important to look at those, but not put a lot of weight into them, because we still have to continue to do the right thing, because those projections can change on a dime.
Yeah, we'll come back to that, I'm sure, in just a moment. Carrie, I can't tell you how many times these questions have come up to us, and I don't really know that much about it, so I bet you do. So talk to us about moms, pregnancy, and coronavirus.
So we get a lot of questions as well, and one of the things is that you know, being pregnant is a time of lots of questions anyway, and a little bit of anxiety. So this is adding to a lot of our patients, and we want people to know that that's normal and it's okay to have these questions. We certainly encourage all of our patients and women that are pregnant to reach out to their doctors to ask specific questions if they have any. As with any new disease or type of virus out there, our data is somewhat limited, especially in pregnant patients, because the population is much smaller than all of these patients out there. So a lot of this we are learning as we go daily, and we're finding out things every day. But what we've seen so far is that we believe that pregnant women are at no increased risk versus the general public of getting COVID. So what we recommend to our pregnant patients is following the same good hand hygiene recommendations, social distancing, stay away from sick people, all of those things that we tell every other person, pregnant or not. And I think that's really important to stress to all of our patients. As far as what we know about being passed to baby, right now it does not appear to be passed through baby through pregnancy or the delivery process, which is really encouraging for us, and we are certainly following that as more pregnant patients are diagnosed nationally. But there has been no documented case of a baby born thought to be positive through either the birthing process or pregnancy.
And so, is there a change as far as cesarean sections go? Does that implicate anything if you have a mom that you think may be COVID positive or that you know has COVID-19?
Yeah, so there's no change in recommendations for delivery. That would be delivery route, either a vaginal cesarean section based simply on a positive or negative COVID test. We take a lot of things into consideration when we're talking about route of delivery. That would be maternal well-being or health at that time, as well as baby. So those things change on a dime, but overall, if a patient has a positive test, we would not recommend a C-section based simply on that test.
Yeah. I know I was a nervous Nelly. I think I lost 15 pounds each time my wife had 3 kids, 45 pounds. There you go. So, well, yeah, I think there's just so much information out there on the curves and on what's going on medically every day. There were some articles I read yesterday that compared trying to forecast what the curve was going to be like, akin to forecasting the weather. And we all know how good that works here in Kansas City. And so if you look at the world like that, you think, gosh, what do the curves mean? We're happy we're staying at the same number. There's no question about that. But there is a question of what that means. Are we at the slow rampant phase, or have we really flattened the curve? And it'll just take time to know this. This we do know, though, Kansas City. This we do know. Easter Sunday is a big deal for a lot of families. Shelter in place, trying to keep your distance doesn't change Easter Sunday, and that's hard. My family, we have this big Easter Sunday tradition in our household, and we're like, okay, how are we going to Zoom Easter dinner? And we're all trying to make the same dish. We're going to try to make sure we maintain our distance, and that's hard on a holiday. But what's harder on a holiday is to watch a lot of people get sick 7 to 10 days after that. Because you'll think, we got through it, great, no problem. But 7 to 10 days later, all of a sudden, it is a problem. And so we're strongly recommending Jackson County, Johnson County, Wyandotte County, Platte County, Clay County, Leavenworth County, Shawnee County, Douglas County. If I forgot your county, I meant to mention your county. All of you, stay sheltered in place. Be really thoughtful about Easter dinner. Don't try and bring large groups together, even though you're going to want to do that. Hey, we're open for questions. What do you have out there? People used to have to come off mute and see if they have anything. But in the meantime, Dana, any indications around the state of Kansas or the state of Missouri, not just the Kansas City metropolitan area, about what we think is going on?
I think we still have continued to see increasing numbers in general that continue to be reported every day. It's very difficult, especially for our partners in western Kansas, in the more rural areas of Missouri, because we know that disease is there too. And every day you'll see a trickle of 1 or 2 more cases, and that's the real concerning part. And those less central areas with maybe less resources and things of that nature.
Yeah. Kara, you mentioned that there is a lot of anxiety around pregnancy. I'm guessing for all the people who are pregnant right now, early or late stage, you are getting increased calls and harder because you can't see all those patients right now. How are you guys taking care of that, and how is telehealth working for you?
Sure. So we have modified our obstetrical visit schedule to follow really national guidelines. So we went through and really identified the times when patients need to come and tried to pair those with the essential ultrasound visits and lab visits. So we're not seeing a patient, what we say pre-COVID days. You might very well come and see your obstetrician one day and 2 days later come back for your ultrasound. So we're trying to pair those together, which does decrease the number of times that you see us face-to-face. We've been doing a lot of phone calls and talking to patients. We have resources in our clinic for help. Some of the frequently asked questions links that are vetted by our national our national organizations that patients can take and have that website with them, because we all know that when they see us, they never think of all of those questions. But the minute they walk out the door, 5 or 6 other ones come in. Grandma calls and asks, and so we have those resources. And then in addition, we have some resources for mental health, especially specifically around COVID, et cetera. Around that anxiety and time. But certainly encourage patients, if they have questions, to reach out and ask to get some clarification, because it is a hard time, and things are changing daily. So some of the things that they might have read last week might not be true today. So if there are questions, please reach out to their physicians.
And so from your standpoint and the different specialties of OB, be it, folks with infertility or cancers, any changes as far as that goes with women's health?
Yeah, so on the infertility side, almost 3 weeks ago, it was recommended that all assisted reproductive technologies, or what we think of as IVF, was really recommended to be halted. So during this time, procedures, in the eye of is it essential, et cetera, was asked to be stopped, as well as recognizing that we don't know some of these answers with pregnancy. So it was not a time that we recommend proceeding with assisted reproductive technologies for pregnancy. So REI, the lab and IVF has been shut down for a few weeks. As far as GYN oncology goes, it's cancer. So certainly looking at each of those patients specifically and finding out, when surgery needs to be and what is specifically being dealt with, and talking to those patients specifically, moving a lot to telehealth for follow-ups, et cetera. And I think that's probably our big, our maternal fetal medicine doctors are still, in our ultrasound unit are just as busy as they were, because pregnancy is still happening and still progressing. And those complications like high blood pressure, diabetes, things like that, that hasn't changed at all with this COVID outbreak. So we are working on ways to bring people in, on a more set schedule, like I said, paired with a visit, so they aren't coming back multiple days a week, and following up with telemedicine.
So if I remember, 9 months after World War II, there was a baby boom. Is there going to be a post-COVID baby boom? Yeah,
so we certainly, here in Kansas City, we were joking we were going to deal with the post-Chiefs baby boom, and then following would have a post-COVID baby boom as well, right? But that's interesting, and I think it's up to everyone's guess. There is some people think that actually it will not happen because this has really made people a little bit reflect on resources and what is out there a little bit. So there was actually an article that people actually predict that will not see the baby boom.
Okay.
Only time will tell.
All right, so cheese plus COVID, kind of same story then. Business as
Right.
usual.
I think, we did see a Royals baby boom, so I'm definitely suspecting a Chiefs baby boom, but we're going to have to follow up on this COVID one.
All right, good deal. Questions?
Hi, this is Nate from the health system. We have some questions that have come in through Facebook.
You bet.
One person is asking how we are separating COVID positive patients from non-COVID patients on the labor and delivery unit.
Yeah, so we have not had a COVID positive patient on the labor and delivery unit yet, but we do have an area on our labor and delivery unit that will be specified for those patients. It has a negative airflow area. It is sort of sequestered on our labor and delivery unit.
And you do different PPE with people, different
Of course.
protection with infection control with pregnancies.
Of course, as well as providers as well.
Yeah.
And I have another question. Someone was asking, I guess they're saying that some doctors are prescribing Z-Paks in severe cases, and wouldn't that only work for bacterial infections?
Great question.
Wow, that is a great question. Here at the health system, we have a group of people much smarter than me who have been working on therapeutics, meaning drugs to treat COVID, since day one. We were just meeting today. There is constant publications, there is constant media stories, constant anecdotes about drugs to use for treatment of COVID. And we have to stress, right now there is no FDA-approved medication for COVID infection. But we are issuing a lot of trial medications of hydroxychloroquine and azithromycin as well. There's also other stories and publications that come out all the time about different drugs to possibly use. Some of these may have activity in the lab, but not necessarily validated in a person. So directly to your point about Z-Pak, again, we know that azithromycin can probably have some anti-inflammatory properties, but as you were correct, it's an antibacterial medicine. Interestingly, the journal article that originally published hydroxychloroquine with azithromycin now has lost support for that article by the publishers of the journal it was in. And so for one reason or another, they didn't seem to support it. They said basically because of the inclusion criteria. But based on that, and that was really the only journal article that used azithromycin in combination. So we are actually even deliberating now whether we even need to reduce and take off azithromycin from our clinical trials here. So that's a very good question. It is continually in motion, but I would say if you do have COVID, that I would absolutely not prescribe azithromycin or a Z-Pak alone for treatment of that.
Other questions? Nate or anyone else out there?
I had sorry, I'll let you go first.
Oh, thanks. This is Melissa with Channel 41. Quick question. Looking at the Washington U data and Johns Hopkins and knowing the number of your positive patients hasn't changed much, what can you tell us about what you think is happening in the KC Metro right now? Because since we're all social, distancing and staying home, what's the best way for us to get a feel for exactly what's going on at this very moment?
So, here's the story, right? How many pandemics have we lived through? That would be zero, unless you were born in 1916 or 1917 and you lived through the influenza pandemic of the early 19th or the early 20th century there. I have to keep my century straight. And so we don't really have models for how pandemics act. Not in the modern healthcare world, and especially not with a respirable, which means a virus or a bacteria that you can breathe in and out that causes this trouble. Most of the other, like the AIDS epidemic, was bloodborne, and so it was a little more certainty of how we can act to not spread it. That's not true with something that is so communicable from one person to another. So we don't really fully understand the impact of population density in New York City. Overall, it's like 28 or 29,000 people per square mile. In Manhattan, it's about 95,000 people per square mile. Out on the West Coast, it's 13 to 20,000 people or 17,000 people per square mile. And in Kansas City, in the metropolitan area overall, it's 1,400 people or 1,500 people per square mile. That's a huge difference. We don't understand all the impact of that. Kansas City also closed in the core four, right? We put a stay-at-home order in effect that was early, much earlier, relatively speaking, than what some of the other metropolitan areas, including New York, had done. The schools were shut down. Well, kids are a big vector, and because they're not sick, and so you don't know to do that. And as your parent, you can't really avoid it. And then if you have a parent and you're taking care of an elderly parent, then you may not be able to avoid that. So there's just so many parts of this that we don't understand. It makes forecasting really hard. And that's why the person behind the University of Washington model yesterday said, it's like weather forecasting. It's about as reliable. I think he also compared it to forecasting what was going to be popular on Netflix or what wasn't. So when you think about it like that, you have to understand that the data we're seeing today could still go either way. Are we more optimistic than we were 2 weeks ago? I'm going to be a little curmudgeonly, but I'm going to say possibly, maybe, imperfectly, yes. Do we think that we are going to go the route of the model that is out of Penn, which is called the CHIME model, which has suggested much higher mortality? And it has a lot of variables in it that you try to estimate. You're not sure if they're right or wrong. We don't really know. But that one suggests we don't have enough ICU beds and enough hospital beds. The University of Washington model suggests we do have enough beds and our peak isn't going to be as severe. I don't know which one to believe in right now. So our choice is to stay prepared and be ready for both answers. So what that means is we have to still have the plan for bed capacity and surge capacity that could easily hit our area, because we are seeing increased numbers of cases both in Kansas and Missouri. Let's remember that. There are more people being diagnosed with COVID in both states each day, and there is a rise in the number. What we haven't seen is a rise in the number of ventilators, and I think that's great news. And we have to look across the metropolitan area and see if that's all true. But all it takes is one large social gathering, one large service that people want to go to on Easter Sunday, one large congregation or a group of people coming together and a few folks being sick and then taking that back out into the public and spreading it. The way this stays at a low level is because we've done such a good job of sheltering in place, keeping our distance, washing our hands, not touching your face, and coughing into your elbow. Those things appear to really be working, not just in Kansas City, but across Kansas and Missouri, across the United States, and oh wait, across the world. So the curves are bent when we do the right thing. And we just don't know yet exactly where we are in that curve, but we do know what we have to do to stay safe. And those are the things. So cautiously, imperfectly, possibly optimistic. Dana?
Yeah, and I would absolutely like to add, I'm glad we talked about avoiding the large gatherings, the congregation, because all it takes is maybe one or two children who maybe not be ill, but obviously there's going to be older populations there. But the main thing to these projections as well is we know a little bit about the disease. We know how the disease can maybe not present itself for 7, 14 days. And even when you do get ill, you may you may get a few symptoms, feel better after a few days, and then it hits you, and then you have to go to the hospital and you have critical illness. So we know that the protracted course of this, could be up to 2 weeks, and so any data point we get, we're still going to need to wait 2 weeks on. And I think we're still in the middle of that almost initial 2 weeks. So we still have a lot to go. We still have to be vigilant, continue to avoid these large gatherings if we can, and stop the spread.
And I think the other point to add on is that in 2 weeks, if we have the same number of patients, we're going to have a different conversation. Yeah. At that point, our conversation is going to be, okay, the curve may be flattened. How do we keep it flattened and yet think about what's a safe way of going about and reopening a little bit of society here and there? So, and I'm not a politico, but we can approach it from a healthcare perspective. What does that mean? But it's too early right now to have that conversation, I think, in any honest fashion. And we don't want to build false hope, and we don't want to encourage people to go do things that will then watch our curve take off. That was a long-winded answer. Sorry about that. It was a great question. And we knew we were going to get it at some point this day because the numbers were staying so flat, Melissa. We knew that had to happen at some point. So.
No, that's great. As a follow-up to that, the data that we're looking at, is it just based, though, on the number of people who are tested and the positive cases? So is it even reliable if it's looking at that since we aren't testing everyone?
Okay, I'm just going to say, I'm going to be the first to say it. The data is not reliable because we don't test everyone, and we're only testing a select subset of patients. And it will depend entirely upon what happens with other parameters we have, like the number of people who are positive and in a hospital, the number of people who are on ventilators, or what the University of Washington model uses, which is the number of people who die. And so that's why you have to be careful with some of those models. We're still really early on it here in Kansas City, so the number of people who die may not be as relevant as it's going to be in 2 weeks when there's going to be more death as a result of COVID-19. So that's what's going to help us to determine it. But all these variables, and every model is different. And that's the thing. That tells you how imperfect the models are. You know, every state has a model. Every university has a model. The University of Kansas Medical Center, the university side of our campus, they have a model too. And we've all got models. I think there is reason to be very cautious, very imperfectly, and very reluctantly optimistic. But I think it's really early to be any of those things.
Yes.
So, okay, next question. Nothing yet. Okay, well then.
I'm sorry, Dr. Stites, I do have a question.
Go, Nate. Go ahead. Otherwise, I get to start asking questions. You know, that's always bad news for everybody.
Well, somebody is asking, what are your recommendations for families with children from multi-family households? Do you recommend that, if possible, the children stay with just one parent for a period of time instead of going back and forth?
Wow, that is like the hardest question I think we have had. I'm going to wait for Carrie and Dana to give their answers, and then I'm going to come up with something while I think about it. Go ahead, Dana.
That is a very difficult, complex question, but it happens, and it's the true state of a lot of people's families. And I think I was even asked this on a personal basis from a friend as well. So it is very difficult. You know, you can't control where your children are or who the other person is if they're bringing people into the household from other households. That's really where the danger comes in. I think you need to assess those types of risks and say, well, are there people coming in that I don't know about that could potentially bring it in? So it is very difficult, but I think you have to assess that risk on a case-by-case basis. Certainly it would pose a risk if there's other people coming to the household that you don't know about. Again, the kids can get it. They may not be too ill or have really any symptoms at all, and then be able to spread it to you. So it's a very real situation that takes place every day, and there's no good answer other than just assess the risk yourself and then make that determination, because it is hard not to see your children and not to be with them if you're normally with them. So that's the best answer.
Okay, Carrie, I'm going to turn this question a little bit. Mom comes home with a new baby. Any special precautions that she or the new baby need to take in this world of COVID-19?
I think the same sort of idea of social distancing needs to take place. So everyone wants to show off their new baby, but certainly encouraging moving to FaceTime or Zoom or Hangout, Meetup, whatever all those are called, to show off that baby. It's important that we not have those babies in close contact with multiple family members. There have been newborns or young babies that have tested positive, and it's believed to be because of the contact after birth, not through the delivery process. So certainly recommending continuing that social isolation with that baby as well.
Yeah, and so my answer is the same. It's all about you just have to do the best you can in this world. And there are choices in this world, and there are things that are less of a choice. And I think when you have a blended family, you still have to have that family. And I think that's different than a large Easter gathering, which is a little bit more of a voluntary thing, frankly. Whereas having a blended family with kids that have to move into the household, that's simply a reality. And I think you cope as best you can with it. And if somebody's sick, you do the same thing. You got to try and try to isolate that person as much as possible. And as a young child, that's hard to do as a parent. And so I think, you just have to do the best you can around that and realize that there's a higher risk of transmission to you in that setting. It doesn't matter if it's a blended family or not a blended family, that can still happen. And so I think that's part of being a parent, and that's part of being a family, I think. Questions?
I do have another one that's regarding masks. I know we talked about it pretty extensively yesterday, but someone wanted to know if it would help to clean a homemade mask, maybe a cotton one in the microwave by putting it in the microwave for a few seconds to kill germs.
Dana, do microwaves kill corona?
Well, we certainly know that radiation, whether it's ultraviolet or microwave radiation, could possibly kill the virus. I think your best bet at this point, if not using other household cleaners or detergents, is soap and water. And I think just laundering is probably going to be your best bet.
Okay. Other questions?
I have another one that's just in general asking if this pandemic, if you would compare it to maybe the swine flu outbreak.
I'll let Dana keep that in perspective. Swine flu versus corona.
Yeah,
Who wins?
I would much prefer to go to swine flu, to tell you the truth. Corona on so many levels is so different than influenza. Again, with influenza, we have vaccines, we have therapeutics, we have drugs to treat it. This is novel. This is new. Our body hasn't seen, anything like this. For the most part, we have seen other influenzas in the past, but no, I wouldn't consider this anywhere near close to what the swine flu.
And just to say, the death rate with influenza, swine flu included, is around 0.1 to 0.2%, whereas this is probably 1 to 2%. I think that's where it will settle worldwide. Some places are a lot higher, but if you think about how many people are probably positive out there that we don't know, it's probably around 1%. So it's 10 to 20 times higher, in other words, than influenza.
And those deaths, especially with influenza, tend to also be with secondary or superimposed bacterial infection. We don't really see that in the preponderance with COVID that we do with influenza. So that's the other thing.
Two very distinct patterns of death within COVID. One is kind of this terrible respiratory progression to fibrosis and scarring, and it's what that tends to happen in an older population. And then this kind of large, almost explosion in your body of your infection-fighting things going haywire. Mm-hmm. And when that happens, and that tends to be a little younger population, although get mixed that up and go either way. But that tends to be the pattern, and both of those are very difficult to treat. And antibiotics don't really make a difference in COVID. They make a huge difference in influenza because of the post-bacterial infection. Closer to the end, I'm going to turn to our guests today and ask if they have any parting thoughts. Carrie, we're going to start with you. Things to think about, or things you want to leave us with, or important tips for being a mom in this day and world.
So I just think that, stressing all the same things that we tell our non-pregnant patients is really important. So social distancing, hand washing, and if in a healthcare setting, the appropriate PPE, pregnant or not, is what is essential. And really stressing the need to reach out if they have questions or symptoms to their physician as well. We are tracking our pregnant patients and touching base with them if they do turn positive or have a positive test, to keep track of those symptoms and things like that. So please, reach out, talk to your doctor, stay in touch. And those, I think, what I would say.
And the importance of telehealth, even for a pregnant mom, and maybe especially for pregnant moms. Answer all those questions. Dana?
Yeah. Please, this come in, and as we move forward, stay strong, do the right thing, stay home. These projections that we are talking about, even if they may look good, the nature of this disease and the duration that it could take to be ill, those projections, those numbers could change in the blink of an eye. It could be very different than they are today or 2 weeks from any large gathering or congregation or anything. Please continue to stay strong, stay at home, and stay safe.
All right. Thanks to Michelle over here, our interpreter today, too. You all know that I like to drive by parks on my way home and see how well people are socially distancing, and last night was no exception. Drove by Loose Park, and a lot of people still in the park. But the biggest gathering I saw was 3. There are a couple of those younger folks, and everybody else was either a single or two, and they were all more than 6 feet apart. I was impressed. Is there a cause for cautious, reluctant, imperfect optimism? Yeah, there probably is. But if that's true, it's because of what you're doing. It's because you've been following those guidelines and you're working really hard at it. Don't get cocky. Don't start thinking it's all over. Don't relent, because the ability to flatten the curve and master this is in your hands. It'll be in your hands on Easter Sunday, and it'll be in your hands for every day thereafter for a long time. So keep up that good work, because if we're successful, it's because of what you did. It's because of what you did. No place like home. Thanks, everybody. We'll talk to you tomorrow.